Hi, everyone. Just wanted to give you another quick update about the coronavirus or COVID-19. You may have also heard SARS-CoV-2. That's also a synonym for the same thing. It's probably been in the US, as I mentioned before, since December, so many of us may have already had it and recovered without even realizing it. The number of cases worldwide has now exceeded 500,000 with over 20,000 deaths. The reason we're seeing higher numbers now is mostly because of better testing. More people are getting tested, so the numbers are going up, and they're going to go up quite a bit more. The curve in the US is already steeper than the curve in Italy and China, so I'm a little bit concerned about that. They've been talking about flattening the curve. I don't think that's going to happen. I think at best we can hope for dampening the curve. There's lockdowns going on everywhere. Everyone's staying home. Stores are closed. I couldn't even get receipt for my coffee from this morning. Everybody's wearing gloves. Everybody's wearing masks. We talked before about personal protective equipment. Keep in mind that wearing masks, it has to be at least an N95 mask, and you have to be fit tested for it. Just wearing a mask isn't really going to do it for you. Wearing gloves when you're touching your face isn't going to help, because you're just transferring the virus from your glove to your face. Walking around outside by yourself doesn't really put you at risk, so don't stress about that. If you have any piece of clothing or bags or whatever that you think may be contaminated, leave it outside for 3 days, and then after that, it's probably okay to bring it back in. With regard to the patients at risk, the people that are greater than 85 years old are most at risk, and they have the highest death rate. People under 19 have minimal risk and the lowest death rate. The problem is the younger people sometimes can become carriers and then go home and infect the older people. Pretty soon we're going to exceed our capacity to manage the patients that are coming down with the coronavirus. The need in New York is anticipated to be about 140,000 hospital beds. We only have 53,000 available. The ICU need is going to be about 40,000 ICU beds, and we only have 3,000 available. The good news is the military's already here, and they're deploying in New York. They're going to turn the Jacob Javits Center into a hospital, and that's a huge facility, so that's going to really help manage some of these cases. Already, in some hospitals, they're exceeding their capacity. They have tractor trailers outside that are refrigerated, that are there to hold the bodies of the patients that have passed away from coronavirus infections. Unfortunately, other cities are going to peak probably about 4 to 6 weeks from now. So the peak in New York is going to be earlier than a lot of the other cities, which are going to peak later. Most of the US still hasn't seen a big problem with the coronavirus, but unfortunately, I think that's coming. It's come to the point where many places, they're actually triaging patients to decide who's going to get to be on a vent and who's not, just because of the shortage of ventilators. They're also sharing ventilators between patients just because the sheer numbers of patients requiring ventilator support is exceeding the number of ventilators that are available. I just want to talk a little bit about the medications that are out there to combat the coronavirus. There was an antiviral study using lopinavir and ritonavir. They studied 200 patients, and unfortunately, there was no significant difference between the treatment group and the control group. There's a lot of talk about chloroquine. Ever since the president mentioned that on a press briefing, people have been going crazy over chloroquine. Keep in mind, there's really no good studies about it. Chloroquine is available as Plaquenil, which is hydroxychloroquine here in the US. It's an old medication that was used for malaria. It's been around a long time. It does have side effects. I believe that if you take chloroquine, it'll help zinc get into your cells. And as we discussed previously, zinc will inhibit viral replication. Just want to talk really quick about Nsaids, or non-steroidal anti-inflammatory drugs, namely ibuprofen. Ibuprofen works through the ACE2 receptor on the cell, ACE2. Remember, we mentioned that the virus also gets into the cell through the ACE2 receptor. So taking ibuprofen is believed to increase the number of ACE2 receptors on the cell and may potentially increase the ability of the virus to get into the cells. So not conclusive, but if you don't have to take the ibuprofen, I think avoiding it is probably a good idea. There was another study on favipiravir that was done in Japan that may show some promise and has good antiviral activity. With regard to testing for the coronavirus, keep in mind that the current tests are about 60 to 70% sensitive for catching people who have infections. So it's possible you may test negative, but you may still have the coronavirus. So testing is important, but it's not 100%. The testing for infection is important, but there's also another important thing, that's testing for antibodies. That shows people that have had it, have recovered, and are now immune. With regard to reinfection, there was a study done with rhesus monkeys. The monkeys were infected with the coronavirus, allowed to recover, and they were reinfected, and they definitely developed immunity to the coronavirus, and that was pretty conclusively shown in rhesus monkeys, which is very similar to humans, although it wasn't a human study. So what should you do now? I think right now you should supplement with zinc. Don't take too much. Too much of anything is toxic. So yes, take your zinc supplements the way it's recommended. If you do start to get sick, you may want to try the Plaquenil, but anything more than that, you should be in the hospital setting. There's a lot of talk about Z-Pak or azithromycin. Do not take chloroquine with azithromycin. You can get cardiac arrhythmias and die way before you even get infected with the coronavirus. So what are the keys to ending this shutdown? I know the president had mentioned Easter as being open for business. The likelihood of that is very small. Keep in mind, he's not a physician. He's not a scientist. He doesn't understand how the studies work with these medications, how long it takes for these to become available. And he doesn't understand that the peak for this thing isn't even started. It's going to be 2 to 3 weeks from now for New York, and probably 4 to 6 weeks for other major cities. So I don't see this ending by April. We're hoping by the summertime, but as more data becomes available, we'll probably do another quick update. So what are the keys to ending the shutdown? Well, antivirals being available, immune globulin being available, extensive testing for infection, testing for antibodies. These are all going to be very important to being able to end the shutdown. You probably have heard about herd immunity. If 60, 70%, 80% of the population are either immune or have had an infection, that will protect pretty much the other 20%, but I don't think we're quite there yet. I just want to talk a little bit about personal protective equipment. Keep in mind that currently there's a lot of scammers out there. A lot of people are selling fake masks that don't protect against anything. Be very wary of trying to buy those online. Another hospital here in New Jersey was able to get masks that turned out also to be fake. If you have personal protective equipment from before, those are probably good. However, if you have excess amounts, please try to get those to the people on the front line. We're in desperate need of personal protective equipment. They need masks, isolation gowns, gloves, everything. If you're home, if you're walking outside, if you're not interacting with a lot of people, you probably don't need any of that stuff. I'm not saying give it all up, keep some for yourself, but if you have excess or if you're hoarding, please find your nearest doctor, nurse, somebody in a hospital, and try to give them as many as you can. We're so desperate that right now they're reusing masks, which is a big no-no, and they're even using garbage bags to try to protect themselves. So if you do come across personal protective equipment that you know are legit and they're good, please try to give them to the people that are on the front line fighting this battle for us. I hope you found this helpful. If you enjoyed it, please like us, and you can also subscribe, and I'll try to put up more updates as they become available. Thank you so much.